Hello guys, welcome back to the channel. Let us go through some ischemic stroke related topic MCQs. We hope you will find this useful. We will not be discussing MCQs related to ascending and descending tracts. This will be covered under anatomy. Question 1. A 70-year-old man presents with left-sided hemisensory loss in arm and leg. However, there is good motor function on the left side. His higher cognitive function is normal and he has no visual disturbance. What is the best description of this stroke? A. Posterior circulation stroke. B. Partial anterior circulation stroke. C. Subarachnoid hemorrhage, or D. Lacunar stroke. Let's go through the options again in a little bit of detail. A posterior circulation stroke, if unilateral, would have accompanying motor weakness and cranial nerve affected as well. A partial anterior circulation stroke would also present with visual or higher cerebral dysfunction. A subdural hemorrhage would have other characteristic signs of a bleed such as severe headache, visual symptoms, seizures, and loss of consciousness. A lacunar stroke is the most likely answer as patient presents with a pure sensory stroke. So the answer here is D, a lacunar stroke. Question 2. An 80-year-old man presents with 6 hours history of left-sided weakness of both arm and leg. He is unable to give any history due to his aphasia. A left-sided homonymous hemianopia is also present. His pulse is irregularly irregular and an ECG shows atrial fibrillation. A CT head is done and rules out a hemorrhage. What is the single most appropriate medication to be immediately administered? A. Clopidogrel, B. Warfarin, C. Aspirin, or D. Alteplase. Let's go through the options again in more detail. Clopidogrel is given for long-term prevention of stroke and not given in the acute phase for management of stroke. Generally started after 14 days of treatment with aspirin. Warfarin is used as anticoagulation for atrial fibrillation and not given in the acute phase. Also started after 14 days of aspirin. After ruling out a cerebral bleed, aspirin 300 mg orally or rectally should be immediately administered. Patient presents with 6 hours history of symptoms, which is out of the window period for administering thrombolysis with alteplase. Therefore, the answer is C, aspirin. Question 3. A 65-year-old lady with a history of atrial fibrillation recently was diagnosed with severe depression after her husband passed away. She has been forgetting to take her medications regularly. She presents with 2 hours history of slurred speech and right-sided arm and leg weakness. She is accompanied by her daughter who takes care of her. What is the single most appropriate next course of action? A. Urgent contrast CT head. B. Urgent non-contrast CT head. C. Urgent non-contrast MRI brain, or D. Urgent FLAIR MRI. Let's go through the options again in more detail. A contrast CT head is not required to demonstrate bleed. If stroke is suspected, an urgent non-contrast CT head is the first line of investigation to exclude bleed so that further management can be determined. MRI is not done on an urgent basis for stroke. An MRI will be indicated to detect posterior fossa infarction, namely cerebellar or brainstem strokes. FLAIR MRI can be used if onset of symptoms remains unclear, so more patients can receive thrombolysis. So the answer is B, urgent non-contrast CT head. Question 4. A 75-year-old man, previously fit, presented to the ED with a stroke. He was outside the thrombolysis window and only received aspirin. His blood pressure is 135/80. Fasting glucose is 5 and fasting cholesterol is 3.5. Upon discharge, he has regained all of his previous function. You are the FI1 preparing his discharge. He has no allergies. Following recent NICE guidelines, which of the following medications should he be taking upon discharge? That is, after 14 days. A. Aspirin plus modified release dipyridamole, or B. Clopidogrel plus simvastatin, or C. Aspirin plus modified release dipyridamole plus simvastatin, or D. Clopidogrel plus ramipril. Let's go over the options again in more detail. Aspirin and MR dipyridamole is no more the first agents to be used for long-term prevention of stroke. Clopidogrel is now recommended ahead of aspirin and MR dipyridamole. Patients need to be discharged on statins even if the cholesterol is normal. These help prevent developed stroke in the future. A combination of aspirin and MR dipyridamole can be used in cases where clopidogrel is contraindicated or not tolerated. Patient's blood pressure is normal and therefore patient does not need to be discharged on any antihypertensives. So the answer is B, clopidogrel and simvastatin. Question 5. A 60-year-old man with a past medical history of type 2 diabetes and hypertension presents to the ED with 2.5 hours history of right-sided weakness of face, arm, and lower limb. There's no history of drug allergies. He is a banker, otherwise fit and well on anti-diabetic and antihypertensive medications. On examination, he's afebrile, the blood pressure is 150/85, his pulse is regular, 85 beats per minute, the SpO2 is 95%, and the respiratory rate is 18 per minute. The patient is noted to have dysphagia. A bedside swallow test shows that he has no dysphagia. On vision testing, he demonstrates right homonymous hemianopia. There is also right facial drooping with forehead sparing. The right upper limb power is 3/5 and lower limb power is 4/5. All sensations are intact, Babinski is positive, and blood glucose is 5.5. A CT head done shows no bleed. A CTA shows left proximal middle cerebral artery occlusion. What is the correct definitive management? A. Aspirin 300 milligrams orally for 14 days. B. Thrombolysis only. C. Thrombolysis and thrombectomy. Or D. Aspirin and dipyridamole. Let's go over the options again in more detail. Aspirin 300 milligrams should be given immediately after a non-contrast CT head excludes a bleed. However, this alone is not the definitive treatment. Patient has presented within the window period of 4.5 hours and therefore is a candidate for thrombolysis. However, this alone is not the most appropriate management. According to the updated NICE guidelines, thrombectomy should be offered as soon as possible and within 6 hours of symptom onset, together with intravenous thrombolysis if within 4.5 hours, to people who have acute ischemic stroke and confirmed occlusion of the proximal anterior circulation demonstrated by a CTA or computed tomographic angiography or by MRA, which is magnetic resonance angiography. Aspirin and dipyridamole are useful in preventing another stroke and used in long-term management of stroke when clopidogrel is contraindicated. So the answer here is C, thrombolysis and thrombectomy. Question 6. A 77-year-old man presents to the ED with double vision and vertigo since 3 hours. He has an unsteady gait. His speech is slurred and he is experiencing numbness in his face. His wife that accompanies him says that he doesn't seem to talk sense sometimes and becoming increasingly drowsy. What is the single most likely diagnosis? A. Inferior cerebellar stroke, B. Brainstem stroke, or C. Frontal lobe infarction. Let's go over the options again in more detail. An inferior cerebellar stroke presents with vertigo, nystagmus, and postural instability. A cerebral stroke does not present with decreased levels of consciousness. Brainstem stroke is likely, especially factoring in that the patient is becoming increasingly drowsy. The hallmark of brainstem stroke is vertigo, ataxia, and diplopia. A frontal lobe infarct would not cause an unsteady gait, double vision, or vertigo. So the answer is B, a brainstem stroke. Question 7. A 68-year-old lady, known diabetic, presents to the hospital 3 hours back with a history of slurred speech, right-sided upper and lower limb weakness, and hemianopia. A CT was immediately done and showed no bleed. What is the single most appropriate treatment to be immediately given? A. Alteplase, B. Aspirin, C. Streptokinase, D. Warfarin, or E. Clopidogrel. Let's go over the options again in more detail. Alteplase can be a possible answer. However, since the question is asking about immediate treatment, this cannot be the choice. Also, we do not know since how long the patient is having the symptoms. All we know is that the patient arrived to the hospital 3 hours back, so we cannot be certain if patient is in the window period for thrombolysis. Aspirin 300 mg oral or rectal needs to be immediately administered. Streptokinase is not the right answer and not recommended by NICE guidelines. Warfarin is an anticoagulant used for the long-term management of atrial fibrillation. Clopidogrel is an antiplatelet treatment for long-term use in order to prevent further strokes in the future. This would have to be started after 14 days of treatment with aspirin. So the correct answer is B, aspirin. Question 8. A 63-year-old lady had a stroke 2 months back. She lives with her husband, who is 70 years old, and she is his sole carer. She had a prolonged admission at the hospital due to her stroke and had been very anxious to leave the hospital to return to her husband. On the day she was getting discharged, there was a delay in paperwork. She felt very frustrated and so keen to be with her husband that she decided to leave the hospital. Today she visits her GP because she complains of ongoing weakness of her right arm. She is unable to take care of her husband and keeps tripping up the stairs as she tries to go to her room. She is taking clopidogrel and simvastatin. What is the single most appropriate action? A. Refer her to the neurologist. B. Occupational therapy referral. Or C. Speech therapy referral. Or D. Start her on antidepressants. Let's go over the options once again in more detail. Residual symptoms after a stroke are expected. This does not need any specific medical management from the neurologist. Occupational therapy help patient better cope with their symptoms by analyzing and modifying home environment and also by providing support. Patient has no swallowing or speech issues which warrants speech and language therapy referral. Patient has an organic cause for his symptoms. A depression is less likely. Stroke patients may require a multidisciplinary approach to management of stroke symptoms. Upon discharge, arrangements are made for the long-term management of stroke in the community once patient goes home. So the answer in this case is B, occupational therapy referral. Question 9. A 70-year-old man had a recent partial anterior circulation stroke. He presented with a left homonymous hemianopia along with other symptoms. You requested him to inform the DVLA and stop driving for a month. Patient has returned today after a month for his follow-up appointment to reassess his vision. His visual field is still restricted. You noticed the car keys in his hand and asked him if he had informed the DVLA. He says he did not find the need to do so. He has been driving the past month and finds he is doing just fine. He also insists that he has never had an accident before and justifies why he thinks he should carry on driving. Towards the end of the appointment, you ask him how he plans to get home, and he says, I live just 5 minutes away. I think I will drive home. What is the single most appropriate action? A. Counsel him again to stop driving and for him to inform the DVLA. B. Inform him that because he continues to put himself and the public at risk by driving, you will need to inform the DVLA yourself. Or C. Advise the patient to avoid driving in the night and on cloudy days. Or D. Inform him that he cannot drive heavy goods vehicles but can carry on driving his car. There is clear evidence that despite asking the patient to stop driving, patient continues to do so. Despite his ongoing visual impairment, he wants to continue driving as he has never had an accident before and would like to carry on driving. The patient puts the public and himself at risk. Therefore, it is necessary for you to inform the DVLA yourself. Generally, it is not the responsibility of doctors to inform the DVLA unless there is clear evidence that the patient did not tell the DVLA and continues to put the public at risk. So the answer is B. Inform him that because he continues to put himself and the public at risk by driving, you will need to inform the DVLA yourself. Question 10. A 65-year-old man, known hypertensive, diabetic, and hyperlipidemic on medication, presents with aphasia. No one has accompanied the patient. You are the FI2 examining him, and although he cannot talk, he seems to follow all the instructions that have been written by you. Which of the following arteries is the most likely cause of his symptoms? A. Left anterior cerebral artery. B. Posterior cerebral artery. C. Left middle cerebral artery. Or D. Right middle cerebral artery. Left anterior cerebral artery infarction does not cause aphasia. It leads to contralateral hemiparesis and sensory loss in the lower extremities more than the upper. Posterior cerebral artery causes contralateral homonymous hemianopia with macular sparing and visual agnosia. Left middle cerebral artery infarct causes contralateral hemiparesis, sensory loss, hemianopia, and aphasia. Right middle cerebral artery would cause contralateral hemiparesis, sensory loss, hemianopia, and no aphasia unless the right frontal lobe is the dominant hemisphere. In this question, we want to know if it is the right or left middle cerebral artery that has infarcted. Given that the patient has a global aphasia, his dominant hemisphere must be affected. Since the question does not state whether the patient is right or left-handed, we need to answer this based on probability. The percentage of right and left-handed individuals with a dominant left hemisphere is 90% and 60% respectively, making the left always the most likely affected side regardless of handedness. So the answer in this case is C, left middle cerebral artery. You can pause the video and go through this chart, which takes you through the different lesions and their respective symptom manifestation. I have only mentioned those that are commonly seen in exams. This might be helpful in confirming the possible artery that might be affected, causing stroke symptoms. Question 11. A 70-year-old lady with history of hypertension presents with 1 hour history of double vision. She complains of blurred vision and feeling dizzy. The left side of her face also feels numb. On examination, left eye pupil is constricted and there is ptosis. There is loss of pain and temperature on the left side of her face and decreased sensation on the right side of her trunk and limbs. On a bedside swallow test, you also note that she has dysphagia. What is the most likely diagnosis? A. Weber syndrome. B. Left-sided total anterior circulation infarct. C. Wallenberg syndrome. Or D. Left-sided partial anterior circulation infarct. Let's go over the options once again in more detail. Weber syndrome causes crossed findings, that is, ipsilateral cranial nerve 3 palsy and contralateral hemiplegia or hemiparesis. Total anterior circulation infarct causes unilateral hemiparesis and or hemisensory loss of the face, arm and leg, homonymous hemianopia, and higher cognitive dysfunction such as dysphasia. Wallenberg syndrome, also called pica syndrome, causes dysphagia, vertigo, diplopia, nystagmus, ipsilateral sensory loss in face, contralateral sensory loss in trunk and limbs. A partial anterior circulation infarct causes 2 out of 3 of unilateral hemiparesis and or hemisensory loss of the face, arm and leg, or homonymous hemianopia or higher cognitive dysfunction such as dysphasia. So the answer in this case is C, Wallenberg's syndrome. Question 12. Patient arrives at the emergency department via a blue light ambulance with suspected stroke. You quickly go over the notes by the paramedics and can find syncope scribbled over as the presenting complaint. You are confused as you were told the patient arriving possibly has a stroke. You decide to quickly examine the patient yourself before ringing the neuro registrar. Which of the following is a recommended tool that you would use to assess a patient in this situation? A. FAST, B. ABCD, C. Chad's FAST score, or D. Rozier's scale. Let's go over the options again in more detail. FAST is used by the general public and not in an ED setting to help recognize stroke by the common man and seek immediate help. ABCD score is a prediction tool for use in triaging patients presenting with an acute transient ischemic attack. Chad's FAST score is used to predict thromboembolic risk in patients with atrial fibrillation. Rozier stands for recognition of stroke in emergency room and is used to differentiate between stroke and stroke mimics. Hypoglycemia should be ruled out, and a score of more than 0 means that stroke is likely. So the answer in this case is D, the Rozier scale. Question 13. A 60-year-old lady presents with 2 hours history of right-sided weakness. On examination, there is no evidence of higher function deficits or visual field defects. The right upper and lower limb have 3/5 power. You suspect a stroke and have requested for an urgent CT head. Based on the clinical examination, what type of stroke is this? A. Partial anterior circulation syndrome. B. Posterior circulation syndrome. C. Total anterior circulation syndrome. Or D. Lacunar syndrome. Let's go over the options once again. A partial anterior circulation syndrome would present with 2 of 3, that is, higher cerebral dysfunction or homonymous hemianopia or unilateral weakness with or without sensory loss. A posterior circulation syndrome would present with cranial nerve palsy and a contralateral motor and sensory deficit or bilateral motor or sensory deficit, or a conjugate eye movement disorder such as gaze palsy, or cerebellar dysfunction, or an isolated homonymous hemianopia or cortical dysfunction. A total anterior circulation syndrome would have all 3 of higher cerebral dysfunction and homonymous hemianopia and unilateral weakness with or without sensory loss. A lacunar syndrome would present as a pure sensory stroke or a pure motor stroke or a sensory motor stroke or with ataxic hemiparesis. A lacunar syndrome is caused by occlusion of the penetrating arteries that supply deeper structures of the brain. In this case, patient is having a pure motor stroke. So the answer is D, lacunar syndrome. Question 14. A 77-year-old man, diabetic, presents with left-sided weakness in his leg and arm, along with left homonymous hemianopia and dysphasia. A stroke is suspected and an emergency CT head done. CT head rules out hemorrhage. What is the single most appropriate medication to be prescribed to help reduce the chance of a long-term brain injury from the insult? A. Aspirin, B. Alteplase, C. Clopidogrel, or D. Atorvastatin. Let's go over the options again in more detail. Aspirin, clopidogrel, and statins are medications that will help prevent the development of stroke in the future but cannot prevent long-term brain injury from this insult. Therefore, they are used for the long-term management of stroke. Alteplase is used for thrombolysis, and it is the only agent, if given within 4.5 hours of symptom onset, would increase the chance of a good outcome. Therefore, the answer is B, Alteplase. Thank you guys for taking the time out to listen. If you found this helpful, kindly subscribe to our channel and share the video so that others can benefit from it too. All the very best. We can do this together.